This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Hi, Sg2 Perspectives listeners. We are trying something fun and maybe a little dangerous. On May 22nd, we're hosting a live podcast where you can join us for the recording of an episode. Our relationship right now is a little one-sided and we want to meet you. So we'll put you in my chair. You can ask us questions, share your insights, or just heckle us. There's more information in the show notes, but you do need to register so you can get a link to attend. Hope to see you there.
We are seeing that crunch across all sites of care. The workforce challenge is a little bit of a different story, more so that it's been going on for a lot longer. And then finding those right paths to the right place for those patients who may need higher level acuity care is available to patients along the system of care.
Hello and welcome to Sg2 Perspectives. I am your host and panelist today, Tori Richie, and I'm joined by my colleagues Karyl, Kopaskie, and Chad Giese. And we're going to talk all things impact of change forecast. We are on the precipice of the 2024 impact of change forecast being released to our members, and thought it would be fun to get the three of us together to chat about the key forecast trends that we see. How is utilization changing across sites of care? And what are some of the wild cards that we're projecting for the future? To set the stage, Chad and Karyl, we recently received end of year 2023 that showed inpatient and ED utilization was up rather substantially for calendar year 2023 versus 2022. What does that mean for future utilization? Chad, what are your thoughts on what's driving that year-over-year increase?
Well, first, Tori, this is really an exciting time of the year as we get to see the results of months of work now come to fruition, and we get to dive into that 2024 IOC forecast that we've spent so much time putting together. To me, it's a bit like a big unveiling moment, and we are really excited to share this with our members in the coming weeks. Your observations in the recent data are interesting. There are a couple of themes that we've heard over the last few years that continue to come up as we're working with our members, such as increasing patient acuity, increasing demand, not just at one location within the system of care or that care continuum, but across almost all locations associated with the system of care. We hear capacity constraints, we hear workforce challenges, and all of this, I think, is showing up in the data that you were just describing, where we've got an increase in emergency department visits. We have an increase in inpatient discharge and days utilization across all services. We really have to look at the supply side here. Even though our forecast is a demand-based forecast, we have to look at the supply side and understand how bottlenecks at various points across that care continuum or that system of care are impacting some of these high acuity touch points. I think we have to really ask ourselves, is the ED once again the front door of the hospital given access issues in the community? The hypothesis is that as ambulatory access points remain constrained, that the inpatient side is going to feel the brunt of it. And that's what we're seeing play out. For example, let's just look at the heart failure population. It's been a constant challenge for organizations over the last 10, 15 years. And if there isn't timely access to ambulatory services, such as rapid access clinics to help patients and intervene earlier in a patient's decompensation, they're far more likely to end up in the ED. And Tori, we've talked about this disease-based clinic model and chronic disease program build out in the ambulatory space for a very long time. And it seems to be continuing to challenge organizations. So how do we break this trend, not just for CV, but for all conditions? Because as you noted, we're seeing this increase in inpatient discharges year over year across all conditions. Now, I think what's interesting is if you look at our forecast for the 2024 update we just are rolling out now, those outpatient growth and outpatient volumes are continuing to grow at a robust level. For cardiovascular services, we're looking at 25% growth in outpatient volumes. Neurosciences, 21% growth. Orthopedics, 14% growth. Cancer, 17% growth, just to name a few. This is where organizations are going to have to get creative to say, how do we meet the demand here, given we don't have endless resources? We need to come up with ways to support our members in living out that creative care redesign.
That's right, Chad. And we're seeing this cascade effect where We see that acuity rising in the ED. We're seeing the percent of those ED visits that are higher acuity or emergent visits in our parlance increasing from 2022, about 2%, which when we keep our inpatient admit rate relatively steady, does mean we're having more of those admits from the ED. And as we think about that acuity landscape, of course, we've got some of those trends in acuity we've been talking about for a long time. And one of those that really stands out is behavioral health needs, and knowing that there is that increased demand for behavioral health conditions as a comorbid condition and how that can contribute to length of stay, not only in the inpatient setting, but also in the ED environment as well. And so as we think about how those factors are playing together as patients are higher acute coming to the ED, as we are managing those behavioral health conditions across all of our sites of care, how does that then cascade into the inpatient space where we do see increases in some spots on the discharges, but really where we're feeling that pressure is on med days and capacity.
That's an important point because if we look at the last 12 months, increases in utilization for the ED and inpatient span nearly all service lines. The exception to that, infectious disease, largely driven by declines in COVID and flu volumes in the ED and inpatient setting. Women's health, there are declines, which we could talk at length about what's happening there. But otherwise, it's every service line. That's where in the short term, in the last 12 months, I don't know that it's a rising acuity story. I feel like it's more of an access story. If these patients aren't able to receive ambulatory access where they can have their conditions managed, is that then pushing more people through the front door of the hospital, which is the ED, driving up utilization there, then converting a higher count of individuals to the inpatient care setting downstream. And that's an important caveat with the forecast is that what we're projecting is demand. It's strategy agnostic, and it becomes a real chicken versus the egg situation. There are instances where you deploy some strategy and that's then going to lead to folks being able to avoid ED or inpatient utilization because you are managing them upstream. On the flip side of things, if you continue to face these supply challenges from a staffing perspective, what ultimately ends up happening is you're exacerbating the acuity level of patients, which is going to then essentially funnel them to your ED and inpatient care settings. Using the forecast as a starting point, but then based on how those dynamics shift in real time to then fine tune those projections really allows our members to figure out where demand is actually going.
I would say yes. We are seeing, and especially at our children's hospital member sites, they're really feeling that crunch across all sites of care. The workforce challenge is a little bit of a different story, more so that it's been going on for a lot longer for peds. The dearth of pediatric subspecialists has been true for quite some time, and all signs point to that only becoming more of a challenge going forward. Needing to be really creative about how to extend the reach of that subspecialty care to pediatric patients to ensure they get the care that's needed in the community, and then finding those right paths to the right place for those patients who may need higher level acuity care that's centralized at the children's hospital versus what's available to patients along the system of care. It's a similar story with a slightly different flavor, but absolutely we're seeing similar pressures on the pediatric side as well.
And Karyl, that hits on such an important concept. As demand in this current resource-constrained environment continues to grow, how then do we ensure that we're opening up access to the patients that need those high acuity services most? What are your teams recommending to organizations to work through that equation?
One thing we've been doing some research on is what are some of those connections between access challenges and different social determinants that people in the community may be facing. So especially when we look to some of those chronic care conditions that we think of as driving both substantial inpatient and outpatient demand. So thinking here, diabetes, end-stage renal disease, sleep apnea, hypertension, those conditions where we have double-digit demand on the outpatient side, but also substantial and in some cases double-digit demand on the inpatient side. What does access look like for patients in different communities, and how does that access vary based on what those community resources might look like? we've been doing some analysis to correlate that utilization in the inpatient space with communities' resource level and have found that there's a tight correlation. Those communities that have more substantial resource needs do have higher utilization for these chronic care conditions. And so that presents a real opportunity for health systems to pair up their initiatives to help reduce health disparities for patients with these chronic conditions, ensure that they're working upstream and incentivizing that work upstream to help mitigate some of that inpatient utilization that may be avoidable if we can get these patients care earlier in their disease or earlier in the system of care. That's one area that we've been doing some research in and encouraging folks to look at. Chad, how else have you been advising members in this area?
We've taken a different perspective on this topic than what you've just described. While access challenges significantly impact disease progression as well as patient outcomes, we've been doing a lot of research from more of an inward look at care delivery that looks at system optimization or systemness. We've been leveraging a novel analytic approach to identify areas where volume quality links are very strong. Think surgical valve procedures, CABG, or even some high acuity cancer surgical procedures that could really benefit from a consolidated approach as opposed to having multiple low volume programs across a health system. It's really taking that view of once patients are in the system, are they being treated at the right location that will provide the best outcomes at the lowest cost and the best use of resources? We have some frameworks that we have applied historically here that have been core to SG2's identity, the system of care curve. It's been around for over a decade and continues to be utilized in strategic planning projects. The basic, intermediate, and comprehensive program definitions have been incredibly valuable for identifying where you are today and where you want to go tomorrow or who you want to be tomorrow. But now we really have data to inform some of these frameworks that when you combine them with our forecast projections can really help organizations manage demand, achieve growth, as well as ensure you're delivering care at the highest quality possible. So while the forecast's a great place to start, there's real power in this combination of cost, quality, and market data to ensure that your resources are being put to the best use.
That where the forecast really excels, it's digging into and understanding some of the trends that are coming down the pike, how that's going to change utilization, what new headwinds or tailwinds we might be facing at a very granular level. Where the real magic is it's figuring out what are those frameworks that members should be using to drive change within their organization and to really develop strategies that are going to allow their system to be successful long term. I don't know about you all, Chad and Karyl, but to me, it goes beyond just the forecast number. Sure, it's really exciting to tell folks that outpatient surgical services are growing 25% over the coming decade. But so what? What does that mean? Being able to think through, you need to layer in the social determinants aspect to understand how access should be improved. You need to understand then system of care optimization so that you're building out the correct access point for folks as they need it is really where the meaning comes into play.
Tori, I couldn't agree more. It absolutely goes well beyond just knowing the growth number in a particular area. We've been looking at novel ways to integrate cost, quality, and market data for a number of years now. And the insights that we've gained are super valuable when we're working with organizations around their strategic planning process. So grow what you're good at. It becomes necessary to pull in the quality data so that you aren't going to market and trying to grow something that you may need some operational improvement in first. And then finally, improve the quality and operations before going after new growth areas. It's absolutely critical to ensure that you're putting the forecast to work in the right areas and you're doing the patients a service by really improving quality, improving operations, and ultimately improving your financial position as well. It definitely goes beyond just the forecast number. And now at Vizient, it's exciting that we can actually pull together multiple data assets that do inform that cost, quality, and market component comprehensively.
One point that I would add to that is also to help our members find focus. There's a lot of potential distractions out there. There are a lot of opportunities to act and also a lot of things to be reacting to. Using the forecast as a tool to help prioritize, adding that to some of the other data assets that we have access to allows folks to get very specific in diagnosing the opportunities that they have and choosing a path forward that will allow them to capture the opportunity, but also address some of the underlying challenges that might be in place in their market.
I love that. We've hit on what some of the key trends are, what was top of mind for us when refreshing the forecast this year, how to use it. I'm curious to hear from each of you. What's kind of a wild card that you think is cool and interesting that we baked into the forecast this year? Karyl, I'll start with you.
One that we've been watching for a few years now, but put some more emphasis on this year are the impacts of climate change. There are some direct effects that we have been thinking about for a few years, things like increasing in allergy as we see pollen patterns change across the country, watching different trends with asthma as it relates to that, and other respiratory conditions. Something we're also watching very closely is the effect that climate change will have on the infectious disease landscape, changing potentially the seasons in which different conditions start to become more prevalent, or emerging diseases themselves as something else we're watching. But also thinking about some of those cascading effects as temperature rises across the country. What effects could that have on demand for things like dehydration? Or how could that exacerbate some other chronic conditions that patients may be managing? And so that's something that I know we've built in across multiple care families throughout the forecast, and is a trend that we're going to continue to watch. Not necessarily one that hospitals can take a very proactive stance in mitigating, although there are certainly sustainability factors that we see folks diving into and leading on, but certainly something that we'll want them to be thinking about how that might change prevalence of different conditions, especially seasonal conditions, and how we might need to rise to that challenge. On the women's health side of things, we are still watching very closely those birth rate and fertility trends across the United States. Just last week, the preliminary birth data from the CDC was released, and we saw again a 2% decline in the total births in the US, resuming our trend of declining birth rate after that brief bump up post-pandemic. And that's reflected in our forecast this year. We are still expecting declines. We are expecting that rise in maternal acuity. There's been a lot of conversations about the maternal health landscape in the U.S. There are several policy initiatives in play to try to improve that care path for women and pregnant people, both prenatally and as well as postpartum. But still a lot of work to do to improve the health in the maternal population. And so we do see that proportion of high-risk pregnancies increasing, as well as downstream neonatology demand increasing as well. We are also really excited on the gynecology side. There's a lot of attention. Lately, I've been talking to a lot of members about comprehensive women's health programs, especially programs based around needs for women who are postmenopausal or going through menopause. We've got some new care families that can help tease apart what is that need for care for the midlife woman population and that holistic care for women after reproductive years. So a lot of exciting things happening in the women's health space, and certainly a lot of trends that we're watching on the policy front as well.
This is where the team has had a lot of fun, and it's the area of innovation. There's so much going on. It does provide some challenges to keep track of all of this. Remember, we're looking 10 years out in our forecast, so trying to create a quantitative model using qualitative information is not easy, and the team spends a lot of time trying to bake in the impact of some of these novel therapeutics or care redesign or protocols that really do benefit patients or have the ability to benefit patients. Things like ortho smart joints that actually have Bluetooth sensors in them that can talk to us about the function of those joints. CV, there are a number of new therapies coming down the FDA approval pipeline. Things like pulse field ablation that have a real operational and throughput impact. In cancer, the topic of immune effector cell therapies continue to draw a lot of attention and, quite honestly, challenging organizations to think about their cell and gene therapy as a program, not just from a specific clinical application. On the neurosciences side, a lot of advances going on. We know that the Alzheimer's and dementia space has been impacted greatly, but there are other areas that utilize minimally invasive surgical approaches for hemorrhagic stroke. We also have focused ultrasound for various treatments as well that are continuing to grow. And things that cut across service lines. Let's look at the GLP-1s. Oh my goodness, this is going to have a huge impact on certain areas of our forecast. Think bariatrics, but there isn't one service line that isn't impacted by this new therapeutic area that impacts weight loss. Just know that we are constantly reading clinical publications and reports to really get our hands around the broad impact across all service lines for this classification of pharmaceuticals. And then we have some care redesign topics that continue to be top of mind. You can think of the ambulatory shift of procedures to ASCs. It is relevant for orthopedics, it's relevant for CV, and it continues to be something that we model out using our data assets. So innovation is a fun topic. It provides a lot of challenge, but the team is up to that challenge and really putting some novel approaches in place to account for them in our forecast.
Definitely agree with that, Chad. It's such an exciting time. And the innovation side of the house is where some of the most exciting stories live. I know that's what we really like to dig our teeth into, is what's coming down the pike that will either change the way we deliver care or change those demand patterns that we're watching so closely, including infusions.
I'm glad you brought up the topic of infusions. This is an area that is experiencing incredible disruption at the moment. This one clinical area involves so many different forces going on in healthcare at the moment. Think site of care shift, ambulatory infusion centers, home infusion, payment changes. Some of this involves site neutral payment from CMS, but it also includes steerage from the payers around where services like infusions can be offered, as well as therapeutic advances that increase that pipeline of infusion therapies. In order to really craft that long-term infusion strategy, we're recommending taking a very clinical lens to craft that strategy, as well as working with your clinical experts to make sure that it's comprehensive and includes the major areas that are impacted by infusions, namely cancer, medicine, and neurosciences. If you want more information here, tune into an upcoming multi-service line infusion webinar that my colleagues are offering later this month to get more details. There's plenty of opportunities here to get smart. The infusion landscape, we have more resources that we're coming out with on a regular basis here at SG2 on this topic.
That deserves quite a bit more space, but it's certainly something we're watching closely. We're waiting with bated breath to see how that will impact not only utilization, but how care is deployed across the system of care. There's a lot of excitement, especially among the pediatric clients, for how this might help with diagnostics, especially in the genetic condition spaces. I know there's some work to try to see how AI can help better diagnose within the cancer landscape as well, to better pair those medications to the specific condition and reduce trial and error for those patients. There's a lot to be excited about. A lot of questions still remain, but certainly something we're thinking about as we're forecasting each year.
Karyl, Chad, thank you so much for joining me today. And thank you for being excellent partners in the impact of change process each year. It's just so fun to get to work with you and your teams as we take on where's healthcare going over the coming decade. To those of you listening, please be sure to check out all of the resources related to the 2024 Impact of Change refresh on intel.sg2.com. Thank you.
Thank you, Tori.
This was fun, Tori. Thanks for having us join you today.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.